A study showed that 17% of men and 25% of women have experienced some episode of major depressive disorder throughout their lives. If you are feeling like Naruto, please talk to your therapist because you may have major depressive disorder or anxiety. Or none of those. You never know unless you talk to your doctor or your therapist.
Hi, I'm Dr. Benson. Okay, from what I've heard and read, you're diagnosed with major depressive disorder. I'll prescribe you Indolor. Indolor is the brand name for Escitalopram. Escitalopram is a drug that treats major depressive disorder and anxiety.
Escitalopram is different from other SSIS because it binds to the primary sites of the serotonin transport protein.
Escitalopram binds to the serotonin transporter and causes the serotonin to be transported to the serotonergic neurons. This process increases the serotonergic function in the central nervous system.
So you can also think of this example as going to Wegmans. At Wegmans, there's two doors. One is in, and you can only go in. The other is out, and you can only come out, and you can't go the other way. So if something's blocking the door to go in, and only people can come out, then there's more people outside than there are inside. Just like serotonin. Clinical trial experiment. In the clinical trial experiment, 286 pediatric patients with major depressive disorder, also known as MDD, were given Escitalopram. And 290 pediatric patients with MDD were given the placebo. Although the study was done from age 6 to 17, the safety and efficacy of Escitalopram have not been established with age under 12. In a study done with adults, 715 adults were given Escitalopram and 592 were given the placebo. Furthermore, 268 adult patients with MDD were also given Escitalopram in an open-label trial. Among the adult patients who received Escitalopram in placebo-controlled trial, 6% discontinue treatment due to adverse event. That's compared to 2% of 592 patients receiving the placebo. So patient that was taking 10 milligrams a day, there was no significant difference from the rate of discontinuation for adverse event in patient receiving placebo. In the adult trial, patients who were receiving 20 milligrams a day of Escitalopram was 10% rate of discontinuation for adverse event, which was significantly different compared to 10 milligrams a day. The pediatric patients and adult patients data were similar to each other. These are not real scientists, these are actor, non-paid, of course. The adverse reaction were reported of at least 2% for Escitalopram and greater than placebo. There was back pains, urinary tract infection, vomiting, and nasal congestion. In the adult patients, those who were receiving 10 or 20 milligrams per day in the placebo-controlled trial, 8% discontinued treatment because of adverse event, compared to 4% of 427 patients who were receiving placebo. The potential dose dependency adverse reactions in the 10 milligrams were overall the same as the placebo, whereas with the 20 milligrams treated patients, there was greater numbers. Evidence can show that SSRIs can cause unexpected sexual experiences. The risk of sexual dysfunction associated with the use of SSRIs is hard to say, but physicians should talk to their patient and ask about possible side effect. The study have also shown that escitalopram is not associated with orthostatic changes. Patients treated with escitalopram in the control trials do not have any different weight change with those treated with the placebo. Both groups of patients in each group were compared to each other with the respect to mean of change from baseline, hematology, and urinalysis variables, and the patient meeting criteria of potential clinically significant change. The analysis shown that there was no important changes between those two groups. Escitalopram should never be taken with alcohol, triptan, serotonergic drugs, monoamine oxidase inhibitors, or CNS drugs. Escitalopram is orally administered. After escitalopram is taken orally and it goes into the body, the blood level peaks happens 5 hours later. After oral administration, the fractions of the drugs will be recovered in the urine. Escitalopram come in a tablet form of 5 milligrams, 10 milligrams, and 20 milligrams, and no more than 20 milligrams. S-DCT and S-dimethyl-citalopram, or S-DDCT, is what becomes of escitalopram once it is metabolized. Escitalopram is the uncharged predominant compound that is found in the plasma. A steady state of the concentration of that drugs metabolate the SDCT into the plasma. It is about 1/3 of that drugs. A study shown that this drugs is at least 7 and 27 times more potent than SDCT and SDDCT, and this study was done in vitro. In a vitro study using the human liver, a microsome found that CYP3A4 and CYP2C19 are the main isomers involved in the N-dimethylations of the Escitalopram. SDDCT is also recovered in the urine. A study shown that 10 milligrams of escitalopram in adolescents decreases by 19%, and that's the AUC. And then the Cmax increased by 26 in a healthy young patient, age range from 12 to 17. Escitalopram, when in a white powder yellowish form, it is soluble in methanol and dimethyl sulfide. It is also soluble in isotonic saline solution and water and ethanol, and it's slightly soluble in ethyl acetate. In vivo and vitro study done with animals, it had been suggested that escitalopram is a very highly selective serotonin uptake inhibitor with minimal effect on dopamine and norepinephrine neural uptake. When it comes to these drugs, there are other drugs that you should not take with. Here are the long list of drugs that you should not take with these drugs. Bum, bum, bum.
The mechanism of escitalopram starts in the S ionomeres of the racemic citalopram. The S ionomeres is thought to be linked to the stimulation of serotonergic activity in the CNS. It is resulting in the CNS neuronal uptake of serotonin. Escitalopram is different from other SSRIs because it binds to the primary site on the serotonin transporter protein. It also binds to the secondary site that is considered to stabilize and prolong drug binding.
Oh, well, hi there, you guys. I'm Pilly. Yeah, I'm escitalopram pill. Now that we know about the pharmacokinetics, pharmacodynamic of everything, let's talk about the serious stuff, the side effects. I know I'm being a little serious, but hear me out. Also, I hope you don't mind the poor animation. Okay, here's the common side effect: drowsiness, dizziness, sleep problem like insomnia, obviously, nausea, upset stomach, gas, heartburn, constipation, weight change, dry mouth, yawning, ring in the ear, decreased sex drive, and oh, oh, excuse me. Oh, look, it's the lazy animator.
Oh, thanks, Pilly. You know animation is really hard, right? Okay, whatever. If you want to try out our drugs indolore, please contact your health provider, your doctor, your pharmacist, anybody that is qualified to give you an opinion about drugs. And if you have kidneys or lungs disease, please talk to your doctor before using indolore. And thank you to everybody who watched till the end. I know you guys didn't have a choice, but please don't forget to subscribe and like. I would also like to thank Burwell and her husband and Dan and everybody involved in this project, especially Diamond. She helped me a lot. Thank you. Don't forget to subscribe. Also, thanks so much, Burwell's husband, for watching my video.